Exactly 3 weeks ago, the Babirukamu family suffered a calamity when they lost one of their own, John Babirukamu, who was just 2 months shy of his 40th birthday. Unverified reports suggest that John Babirukamu struggled and later lost the battle to depression that pushed him into committing suicide by jumping off a building in Kampala on 31st May this year. John Babirukamu forms part of the annual statistics of the 18 per 100,000 deaths due to suicide in Uganda.
Depression is sickness. He must have been deeply depressed that led him to do what he was doing. We should know that depression is very rampant among young people. And young people do not want to speak, and they want to kind of cope with what they are going through, and it ends up in that situation.
There are reports that expose males as the most affected gender when it comes to depression and later suicide. Citing outdated societal beliefs that portray men as beings that are immune to pain and failure, the Prime Minister Emeritus, Dr. Ruhakana Rugunda, makes a clarion call for all humans to outgrow this fear and learn to open up, especially when faced with problems.
So that society, family, medical experts can work with them to solve those problems.
On this, Collins, one of the Babirukamus, fully agrees.
It's not important to just step up for society and try to look brave, try to look successful, try to look okay. If you have an issue, put your hand up, raise your hand and say something to get help. Get a band of brothers and be accountable wherever you can.
It is important to note that Uganda has a desert of mental health service providers with a forest of depression cases.
The problem now is that even if you have got mental illness, it's difficult to get access to either a psychiatrist or an expert in mental illness. So you suffer in your house, in your office, in your village.
It is for this reason that the former Prime Minister, Dr. Ruhakana Rugunda, wants government to prioritize mental health care by investing in training of psychiatric professionals.
Our society needs to be better educated about mental illness and to know that this is a problem which is widespread, which is underdiagnosed, and that we need more information about it, how it can be treated, and how it can be prevented.
This was at the sidelines of a tribute by members of the Greater Kigezi Dioceses to the Babirukamus in their Kampala-based home in Magere. Dorcas Kimono, UBC News.